any of you Chinese practitioner, and if you have joined last night webinar, I want to let you know this is, if you join tonight one, it'll be same contents and just presented in a different languages. So last night was in Chinese, tonight will be in English, right? But for the CPD, you only get one night of CPD with 2, okay? Even though you joined 2 of them, right? So you only get 2 CPD, not 4 CPD, okay? I just want to be aware of this. Thank you. Then I'm going to start soon. So you guys all can hear me. Hi, man, how are you? I'm just posting on my Facebook. Let's start. Okay, the sound's clear. That is great. Then the recording just start. That's good. You're welcome. Thanks for doing this lecture for us. You're welcome. Michelle, good morning. How are you? I'm good, thank you. Now, Kenny will be the manager of this group. Thank you, Kenny, again. So if you have any question, please just type in and Kenny will check your question and give you a reply. Okay, if while the webinar, if there is any question, you're welcome to type it and post it on top. And because I will be focused on the presentation, and Kenny will help you to figure out everything. So thank you again, Kenny. Then let's start. Now our topic today is about acupuncture and Chinese medicine to differentiate and address irritable bowel symptoms, which is IBS, right? Yeah, thank you, Natalie. Yep. All right. So what is IBS? IBS stands for irritable bowel syndrome. So what are the symptoms? Irritable bowel symptoms is a chronic gastrointestinal disorder. It's very small. I don't know why. I thought I put it big enough that I can see that I'm pretty hard to see this word. That is my bad, okay? Symptoms of IBS include abdominal cramping or pain, bloating, gasiness, right? And alternate between diarrhea and constipation. Yeah. The cause of IBS is currently unknown. Unfortunately, we don't know what causing it. Okay, we don't know what causing it. Now, it's worth for us to point out what are the difference of the constipation and diarrhea between the normal constipation and normal diarrhea. What I mean normal is abnormal. Abnormal. What? The idea of the constipation and diarrhea. What are the difference between IBS and the other two? Right. So IBS, you will get, or your patient will get, diarrhea as well as constipation. They complain this. But the constipation is pretty different, right? So certain urge to have bowel motion. That you want to go and you have to go. You can't hold it. It suddenly come and you don't know where it come from. You just have to go. Okay, and abdominal pain and discomfort. Right, that is the diarrhea. It's very different. Intestinal gases, loose bowel motion. Okay, very loose and frequent loose. It can be watery, not just loose. Nothing in it, just water. It can be like that. Okay. And another one is a feeling of being unable to completely empty bowels. Right. If you're unable to complete the bowel motions, and with nausea. Okay, this is the diarrhea. Now, the constipation. Now, the diarrhea can be 3 times a day or up to even 10 times a day. Then what happened then? Then a normal diarrhea is you get diarrhea, you get it every day, And with IBS diarrhea, you get diarrhea for 10 times, 3 times, 4 times, whatever. Then the next day, it can just stop. No diarrhea. And it can go without any bowel movements for a few days. That is what we call constipation, right? What is this? What does it mean, constipation? Constipation is how often do you go for bowel motion? That's one thing, right? So if you haven't go, normally we should go every day, right? If you go once every 2 or 3 days, then that's constipation, right? Apart from that, then constipation is being very difficult to pass bowel motion. And when you pass, it's hard, and that's what we call constipation. But with IBS constipation, the patient had diarrhea, and in the next few days, 2 or 3 or 4 days, or even 5 days, no bowel motion. And that we call constipation. When they go for bowel motion and they pass out the bowel motion the next time, it actually not too hard. It actually soft, or it went diarrhea again. That's what we call a constipation. Yes, it can get hard, but it's not the same as the real constipation. You don't go for a few days. When you go, it's very difficult to pass. Not the same. This is what I experienced. My patient told me that. I asked him. Now, when you go for bowel motion diarrhea for a few times a day, and then you don't go, and the next time you go, do you actually get a hard bowel motion or you get loose bowel motion? They say, most of them, they say loose bowel motion, or they get little bowel motion, but not loose. Not loose, but probably firm a little bit, but just come out a little bit. Okay. So that is very different. So in here, the constipation, it actually, what I feel and what I see in my clinic is they don't go for a few days, but it's not the same as the real constipation. Okay. Right. Yeah. This infrequent stools. Now, I'm sorry in here that this is all in Chinese. I don't have time to put it in English. Now in Chinese, in 黄帝内经, okay, and Liu Wanshu is one of the famous doctor. It got a 素问玄机原病是 this book. It said about abdominal pain. It's not just causing from the cold, not just causing from the cold inside of the tummy. It can cause from heat, you see? Okay, because most people, we realize that when the tummy get painful, diarrhea, bloating, most of the time we said it is a cold, okay? A cold causing it. But not just that. Liu Wanshu, a famous doctor, Liu Wanshu said, not just cold, heat can cause the pain as well. Now, in 黄帝内经 chapter 69, it's called 气交变大论 here, it said about wood too strong excess. Okay, it can cause eating less and googling in tummy and bloating. Okay, and as well as diarrhea. So that is wood too strong. And also say the fire too strong. You know, what is fire too strong? Which is the heart and small intestine when it's too strong, when it excess, then it can be diarrhea as well. Then it also say when the earth too strong, when the earth means stomach and spleen, excess. When it's too strong, then it'll get tummy pain and as well as diarrhea and bloating, and as well as noisy gurgling sound in bowel, large intestine and small intestine. When the metal too strong, excess again, and it will get abdominal pain. When the water too strong, what does it get? It get the tummy become bigger and the food become bigger, swollen, and it also get bloating, gurgling in tummy, as well as diarrhea and that undigested food in the bowel motions. So what can we see right now in here? This is from 黄帝内经. It talks about 5 elements that is excess. No matter which one is too strong, you know, 5 elements come to 5 organs, right? No matter which one out of balance, it can cause diarrhea, tummy pain, and bloating. Okay, I just want to list this out to show you. No matter which organs out of balance, it can cause stomach problem, diarrhea, and IBS. So this is important. And 黄帝内经 again in 灵枢 chapter 20, it said if the evil qi on 脾胃, which is spleen and stomach, and what happened? If it's cold, then you get gurgling noise in your intestine and abdominal pain. And if you get heat in the stomach and spleen, and you get hungry easily. Okay. Now, this is talking about the cold making in your tummy, and it gives you stomach pain and diarrhea and gurgling noise in tummy. Now, in 黄帝内经 again, in 素问 chapter 39, they say, when the coldness attack intestine and stomach, it make you have stomach pain and as well as vomiting. When the cold attack small intestine, and it give you diarrhea and tummy pain. When the heat, it was cold, right? Attack the small intestine. If the heat attack the small intestine, then the small intestine will get pain. Then it will get constipation with pain, right? So you see what happened in here. It talk about the cold and the heat. It can make you get stomach pain and bloating, you know, and constipation and diarrhea, right? I just want to point out that in 黄帝内经 way back there, we don't have the name of IBS. We don't have the name of IBS. But what do we have? We have a lot of symptoms that is similar to IBS, which means if we use 黄帝内经, the theory on 黄帝内经, to come to the IBS, to treat the IBS, and it will work too. Okay, that's what I want to point out. Okay, the first visit on this case on the June the 8th, 2019. I was so bad, I put it on 2020 last night. I have to go back and collect everything. It was so bad. It's embarrassing. So IBS testing, 31 years old. was born in 1988. Okay. As you can see over here, it got diagnosed 3 years ago. It was with stress, large meal, morning, okay, certain food, better with relaxation, peppermint, intermittent fasting. Yeah, the intermittent fasting, it helped. Okay, has tried low format diet. Okay, low format diet is very popular for IBS. Okay, but if you dig a bit deeper, most people, it actually get better with low format, but quite a lot of them didn't stay the same result. It got worse again. So this patient with low format at first with nutritionist, it got better. It really got better, but she stayed in the low format diet and keep going, and she actually felt worse again. Probiotic definitely help. Enzyme capsule, gluten and dairy-free diet. Okay, it interfered with her work, emotional, social life, and recreation. So nausea. She's felt nausea and pain in the stomach and bloating. She worked as a manager. She managed people at work and got a lot of stress from that and worry a lot. And that doesn't help her conditions. Okay, that doesn't help her condition at all. She also suffered from upper back pain, neck and shoulder pain, 5 to 7 out of 10, due to poor posture, working as a beauty therapist, bending over a lot since 8 years ago. So it used to be, okay, but not anymore. She's not working as a beauty therapy anymore. She was not working as that when she was coming to see me. Was with stress, working at a desk all day, better with massage, heat pack, bath, shooting creams. Right. Now, that's what we want. We want to find the root cause of health problem. All right, we skip that. Her goal is to be able to go to work, travel, socialize without worrying about feeling sick and whether her IBS is going to cause her any problem. Okay, she put it down in her form. That's what she wants. This is her goal. Potential barriers, not finding the cause of her IBS and not being able to manage the symptoms, anxiety and stress making the situation worse. Okay. Now the reason she really come to see us is because it is getting worse, which is affecting her daily life, and it's making her worry that she will be unable to be successful at work and could prevent her from wanting to socialize or travel. Okay. Now, the patient come to see you, they not coming because of they're having pain. Yeah, they coming because of the pain actually stop them doing something or slow down doing something in their life. And this is something that you need to find out. This is something that we always ask the patient, what do you really want? Do you want the pain go away? You can just take some heat pack. You can just take some painkiller. But when that's not working, that's because it really slowed them down and they worry of something and affecting their life, then make them miserable and they can't work or blah, blah, blah. And that's the real reason they come to see you. And you want to help them to achieve that. And that's the main reason they come to see you, okay? If you just know that your patient come because of the pain and you didn't dig deeper and ask them how do I normally ask them? I ask them, is that conditions preventing you doing something that you enjoy, or it stop you doing something that you want to do and you love to do? So you want to find out that reason. Okay, this is what we're doing in our clinic. We ask that question, right? Now, let's have a look at the heart and small intestine conditions. Waking up unrefreshed, tired, fogginess a lot, anxious. On the lung, acne comes and goes, eczema on hand sometimes, but not too bad at the moment. Liver and gallbladder symptoms, headache on the top, couple times a day, on side of the head as well, and you get migraine too. So neck and shoulder tension and tight and pain, we talked about it previously, because in the second complaint, you put this. Okay. Kidney and bladder. She wake during the day, during the night, at least one time to urinate. Frequent urination, urgency to urinate, difficulty to empty her urine, right? Okay. Spleen and stomach, low appetite, stomach pain, nausea, gas, IBS, fatigue after eating, loose stools, diarrhea, alternate diarrhea and constipation. We know they all about that already. Abdominal bloating, yep. Gurgling noise in stomach, dry, cracked lips, anxious. She felt very hot if she's nervous and anxious, or when she drink coffee. She go for a walk 45 minutes a day. At times, not a day, sorry. Lactose-free, low format. There's a diet. She doesn't eat breakfast. She didn't eat breakfast because breakfast make her feel sick. Nausea, light headache can give her diarrhea. Okay, she have water or a green tea in the morning. So she didn't usually have proper meal, proper lunch, but have the following snack throughout the day: 2 mandarins, banana, nuts, small packet of plant chips, some biscuits, carrot sticks, something like that. And at night time, she had meat, steak, chicken, bacon with salad, roast vegetables, sometimes soup or an alternate instead. I'm not quite sure what it is actually. Okay, that's about it. Okay, Now she discovered that the bowel motion, sometimes she got mucus in the bowel motion as well, and passing stools with pain, and even with some watery and burning sensation as well. Okay, and her bowel motion can go without, her bowel motion 3 times daily, and yeah, and sometimes it can go without 3 days, you know. Diarrhea 3 times daily, constipation having once every 3 days for bowel motion. Okay, this is the case. So what's the reason? Why is the reason that we want to ask the diet? That's because with IBS, diet is the key. Watch your diet, then you get better from IBS. Okay, no matter how good your medicine is, you must ask your patient to change diet. Okay, this is something that in my clinic that I would suggest my patient to do. Okay, here you go. This is the stool chart that I show my patient and let them point out what bowel motion they actually get. Okay, so you can write down type blah blah blah, something like that. Type 1, 2, 3, 4, 5, 6, 7, and the normal ones would be type 3 and 4. Okay, for this patient treatment plan, okay, to help to improve IBS, right? To balance all organs function according to TCM, because you see all organs got the symptoms. To help them manage the stress better. So I asked her to come to acupuncture weekly for 4 weeks and 1 herbal prescription per week for 4 weeks. Okay. And then 4 weeks worth of Chinese herbs and 1 re-exam in the end of the month. Okay. And I asked her to put heat on abdomen 30 minutes daily at home. Dietary review and suggestion, emotional daily practice, 3-to-1 acupressure program. The stool chart, you can get it online. Just Google it. All right. So when was the last time I see her and have a look? That was on the 8th of June. And I gave her a treatment plan, and then she came back. I want to tell you that we don't give treatment in the first visit. The first visit is just plain the examination. We talk, we check her tummy, then we go through all the form, and we make a treatment plan. We explain what she needs to do. Okay. So this is important to come to re-examination. Why is that? We put the re-examination in the plan as well. So patient all pay for it first, and then they come for re-examination. In re-examination, we sit down and go through everything to find what's working, what's not working, what's the next plan, you know. So this is important to get initial examination. That's what we do in our clinic. For people that skip that, we're not seeing them. They have to come. They want to see us. They have to come from initial examination. Otherwise, we don't know. For those people, just call in and say, well, how much do you charge for acupuncture? That's what we tell them. We don't know whether you need acupuncture or not. You may not need acupuncture. You may need Chinese herbs, or you may need Chinese herbs and acupuncture. Then, without the initial examination, we actually have no idea whether you need acupuncture or not. So there's no point to letting you know that how much is the acupuncture or Chinese herbs going to cost you, because we just do an estimate, and that estimate won't be accurate. So in general, we won't tell them the price. We offer them it's the best that you see a practitioner to get an initial examination, and that's $40. It's just $40. Normally we charge $120, something like that. So we get them in, and they have to fill in a form, and that's 1 hour re-examination. We only charge $40. Okay. Next, on that day, when she came, 11th of June, pain in the stomach, of stomach meridian, run meridian, and kidney with nausea. So I took the pulse. So for those you have been to my workshop, then you know what this means, okay? But you may be a bit confused because I didn't teach you exactly what I do in here. But what I show you, the pose is still right. You can use those, but this pose is a bit different because a lot of you are just starting to learn pose. So I teach you an easy way, and this one is more going to one by one pose to find out which all the area to figure out which one is running, which one is Michael. Okay, it's a bit different. In this case, now I go for pose. I check that all pose are running on the kidney, spleen, heart, and lung. What it means is when we check kidney, we also check UB, bladder. So between UB and bladder, running strong, in weak. This is running strong. There should be yin and yang should be balanced together like this. When yin weak, that's in here. Yang strong, that's in here. Okay, that's yang strong, yin weak. So what do we do when it comes to treatment? We reduce yang, tonify yin. Okay, that is the principle. Then we go to each organs, the belly organs, the interior, the exterior and interior organ, belly, right? Exterior and interior. Now, on the belly organs, kidney and bladder, which one's yang? Yep. UB is yang, kidney is yin. So in UB and kidney, on both of them, it should be stay balanced. But in running pose, which means UB is strong, SS, too strong. Then kidney is weak. Therefore, in this case, we need to reduce bladder, tonify kidney. Does it make sense to you? Then the herbs for this, we use 八正散. We use 八正散. The ratio is 1, because 1/6 in heath is going to water. Okay, so we use 1. Then the running on stomach and spleen, well, all running minds talking about yang SS. So in this case, stomach is in here, is yang, so stomach strong, spleen weak. So the treatment principle, we are actually reducing stomach, tonify spleen. That's it. So the herbs we use called 清胃散 5. Okay, 清胃散 5. Then in heart and small intestine yang is strong. Running means yang strong. Okay, yin weak, then the heart is weak. So we're going to reduce yang, which is small intestine, and improve, tonify hard, make it to even. So the herbs we use, this is the principle. The herbs we're going to use is 三黄蟹心汤. 三黄蟹心汤, use 2. Now running again, running pose on lung and large intestine. So this is lung, this is large intestine. Running means yang, strong, in, weak, right? Large intestine in here, lung in here. What is the principle? Reduce large intestine, tonify lung, and that would be using the 小承气汤. Okay, no sound. Can you guys hear me now? Kenny, can you hear me? Oh, you can hear me, but the other can't hear you. Can't hear me. Okay, sorry, my fault, my bad. Okay, that's good. Now, this is Chinese herbs. What about acupuncture? Same thing. I just explained to you. Yang, strong, in, weak. Right? That's the pole. I use post-diagnose, and on those different organs. Then the treatment principle is we reduce yang and tonify the mother. No problem. Thank you, Kenny. Okay, balance meridian. What meridians do we choose? Okay. The diagnosis for lung, right? I should put large intestine here. I'm sorry, I missed out large intestine. Lung and large intestine. So lung, we use lung 9, which is 25 lung 9, and reduce 二间. 二间 should be what? Large intestine 2? Maybe I'm right. Maybe I'm right. Or large intestine what? I don't know. It's this point. Is it large intestine 2 or what? I don't know. 行 point of the large intestine. Okay. Or large intestine 3. Is it 3? 二间, not 三间 though. Yeah, large intestine 2. Thank you. Yeah. Large intestine 2. Okay, I was right. Okay. I was guessing. Great. All right. And then we reduce heart 9. No, reduce stomach 45 and tonified heart. Am I right? Sorry. Reduce small intestine 8 and tonified heart 9. And reduce stomach 45 and tonified spleen 2. Reduce bladder 65 and tonified kidney 9. That's it. Okay. Now, if any of you are on Facebook, you can join us by clicking the link above that and log in, and you receive an email, and you can join us on our live webinar platform, and you can watch all the presentation. I got a presentation over here. You probably want to see it. Let's have a look. So this is what we're doing. You can see all this and the image as well. Okay, just showing someone is actually on Facebook, and just showing them they can join us, because I do the Facebook live as well. Oh, what am I doing? Okay, here you go. Okay, so yeah, I do the herbs according to the pose, and I can do the needles according to the pose. Same diagnose, same treatment principle, and I use herbs, and I can use acupuncture. Same theory. Now I want to tell you what happened in here. In the acupuncture, you have a lot of strategy. You know, you can use a lot of different methods to assess to it. Okay. I use balance method acupuncture. I use post-diagnose, but you may not. But we both can treat balance IBS, you see. But which one's better? Which one's faster? Which one get better results? Who knows? And how do we know? We test it out. We test it out. We literally test it out. So with acupuncture, with this strategy, I just show you all the point. I actually put needle on my patient, put it on, and I go ahead and press the tummy to check it around. And the patient said, it's better. That's great. It's reducing, okay? Not as much as tenderness on the tummy. That's great. All right. Then what happened? I came back again and I took out the needles. Oh God, the pain's still there. It's still quite painful. I said, don't worry, remove all the needle. I put another strategy on it, which is Magical 8+1. So here is the Magical 8+1. You can see the main in here, that 8. Okay, you can see the main in here. It actually, all this area, the red area, okay, it can, Magical 8+1 can treat everything in here, which you're using the point of what? Magical 8, you're using the point of lung 7, PC 6, heart 5. In the opposite side, we're using spleen 9 and level 8. Then, on the hand of the other side, we were using large intestine 4 and Szenan-Balance 5. Then on the opposite side of the leg, I was using stomach 36 and GB 34. And I add on plus 四神聪 and 印堂. Okay, so I needle it, and I went ahead and checked the tummy. That was good. What was good? All the tummy pain gone. Just a bit of pain on top of belly button. Okay, you know what I did? I did a cupping, a belly button cupping, the fire cupping. Okay, not the plastic one, using a glass one. And I think I did that for her for about 5 minutes, and I remove it. And on the area are also cold compared with the other skin on the tummy. On the cupping area, it all cold. And the pain on the belly button went, gone. Okay. So I tested out between this one, acupuncture point strategy from the pulse, and Magical 8+1. Magical 8+1 worked better. Okay, but did this one work? Yes, it did work, but it's not as good as Magical 8+1. Okay, it's important for me to test this, because when I test this, it works, and I know that the herbs gonna work. The herbs over here, and I use 小承气汤, and the patient go diarrhea. Do you actually use 小承气汤? 三环泻心汤. The patient actually have diarrhea, and we're using 三环泻心汤. 三环泻心汤 is what? It got 大黄 in it. It make patient diarrhea even more. I use 清胃散, try to clear the heat in the stomach. I use 八正散, try to clear the heat in the what? On the bladder and kidney. So it's very, very different with the diagnosis if you just diagnose according to what patient tell you, the feeling of patient. And if you're on the form, you can all see this. It may not make sense for you. Okay. 15th of June. Felt better in the next day after last acupuncture. Pain returned to what it was in the third day. So dizziness and pain in stomach of spleen, stomach meridian run and kidney, and nausea too. 2 acupuncture, which in 1 acupuncture I actually gave the herbs. But on the second acupuncture, no herbs because the herbs last for a week. So in this acupuncture, I just did, because it was working well, I did 8+1. And again, the pain went away, and plus cupping, and the pain on the belly button went away. Okay. 17th of June, no dizziness, no nausea, pain in stomach meridian and run meridian, as well as kidney meridian. Now took the pulse again, and were there any change? Yeah, the pulse is different. The pulse is a bit different. Okay, based on last pulse and the Szenan-Balance and pericardium pulse is different. So I add on 八味地黄丸. 八味地黄丸, 金匮肾气丸 is the same thing. Okay. So what we do, all the herbs, we put in a tea bag, and patients put in the tea and a cup and drink, sip it throughout the day. That's it. And the pulse still running. Okay. And running micro pulse are actually introduced in 黄帝内经灵枢 chapter 9. If you're interested in that, please go back to 黄帝内经 chapter 9. It's called 中史. All right. With this pulse, I actually try the acupuncture again according to the pulse. So we just running, we use the yang, right? All yang meridian. So which is reducing large intestine 2, Szenan-Balance 10, small intestine 8, stomach 45, GV 38, and UB 65. And tonify what? Tonify in, all the in meridian. According to this case, the in meridian will be lung 9, tonify PC 9, heart 9, liver 8, spleen 2, kidney 7. Right, again, what I tested out again, you know, I say, well, let's see. Let's try another test. A needle in and touch the tummy. All right, it's better. That's good. It works, which means my post-diagnose was good, was right, because the pain on the stomach reduced, but it didn't went away completely. So let's leave it for a while. Then walk out and come back again. Take out all the needles and examine the tummy again. What happened is the pain still there. I say, well, that's fine. Let's try magical 8+1. So magical 8+1 needles plus 四神聪 and yin tang. Then what happened? Bang, all the pain just about all gone. And left a little bit pain in the belly button. And that's good. Which means magical 8+1 work better than this one. So in this case, I tried it the first time, try those two strategies and work out which one's better. And again, in this treatment, I try out again, see which one worked better. Then I prove it again that magical 8+1 worked better than this strategy. Okay, this is what we do in our clinic. If we're unsure, if the patient worked very well, although if they're responding, if I have time, I'll run second acupuncture again. Now, this result will work very fast. As soon as you put magical 8+1, you test it again straight away on the tummy, and you can tell whether it works or not. Okay? Right. 22nd of June 2019. The patient said, no nausea today, light headache, and less pain and tenderness in stomach meridian and run in kidney. Right. So tenderness in the stomach reducing, less pain, right? No nausea. That's good news, which means the herbs are on the right track, and the acupuncture is helping a lot as well. Both are working. Then again, we do just acupuncture in this session. Okay, 2 acupuncture, 1 weekly, 1 acupuncture with herbs, with prescribed herbs. The other one, no herbs. This is no herbs, just acupuncture. Magical 8+1. Now, the 25th of June, respond same as last time actually. So let's go for herbs, and we tested out the herbs, and when the pose went back to the same as the first time. So we remove Bowel 1, just keep the 4 formula. You see, patient taking 小承气汤, we treating IBS with 小承气汤 and 三黄泻心汤. That is very rare. That's very rare. And we treating that with 八正散 and 清胃散. Most people treating IBS with what? They're treating it actually with 补中益气汤, 六君子汤, 半夏泻心汤, 逍遥散, 逍遥加味散, 柴胡疏肝散,理中汤, 四君子汤, 八珍汤, 十全大补汤, something like that. Okay, this is very commonly used, but we use the opposite one. Do I choose to use the opposite one? No, I do the opposite one because these herbs are all according to the diagnose. So don't listen to people say, wow, this herb is good for what. Yes, if you have the same constitutions, if you have the same diagnose according to Chinese medicine, you can take the herb, the same formula, and you will get better. Definitely will get better. But if you don't know about it, people take this herb, they got better. It doesn't mean you will get better. Why is that? Because the constitution may be not the same. Even though the diagnosis is the same according to Western medicine, the diagnosis will be IBS. Yes, you were right. I didn't change it, right? The notes, no, which note is 2020? Oh, I shared the notes differently, right? Probably the yesterday one. If you look at my notes in my here, I think I've changed all back to 2019. Because when I was doing it, I typed the date. I don't copy and paste the date. I can't copy it. So I have to look at that and I type the date. And I automatic in my mind, I just put 2020 because we are on the date of 2020. So when I'm preparing the notes, I put 2020, but actually 2019. Okay. Let's have a look. 27th of June, 2nd of July, 4th of July are the same, the treatment. So I skip that. And that is different because the patient have different condition as well. The complaint is different. Upper spine pain and both shoulder pain. Tummy, pretty good, she said. Pretty good. No pain, only a spot. When I check on it, so I always check on it. I always get my hand and palpitate and see which meridian got tenderness spot we call acid point. and this time pretty good. So she felt pretty good. Okay, tenderness on right kidney meridian when pressing on it. And the herbs, let's have a look. The herbs no change. Why is that? Because the post-diagnose didn't change. It was still the same, the post-diagnose. So we give the same herbs. And on this time, we had a re-examination. So unfortunately, I think I didn't save it very well, because in my system, I have to copy and out of my system and on my computer and type it, and I made a mistake. I didn't save it into my system again, so I couldn't find the re-exam notes, but I only be able to find the re-exam follow-up care plan. And so it was working pretty well. So we reduced the acupuncture to once a week, and with Chinese herbs, weekly Chinese herbs. Every time she comes, we take the pulse and change the herbs. Take the pulse and change the herbs for 7 days, for the next 4 weeks. Okay, and heat on abdomen 30 minutes. That's still the same. One re-exam at the end of the treatment plan, still the same again. Okay, on the 16th of July 2019, okay, respond sore tummy on navel and tenderness on kidney meridian today. So that take the pulse, and that pulse tell us what to treat. Now, and this time is very different. In the pulse, it got running. We know running is yang, too strong, and yin, a weak, right? Yang strong, yin weak. And the yang strong, yin weak is actually on bladder and kidney, and liver and gallbladder, which are the running bladder and gallbladder are too strong, and kidney and liver are weak. But funny enough, the stomach and spleen are different. It's micro pulse. So the spleen actually too strong and the stomach weak. So that is the difference. So when we come to the formula, it changed. The kidney, running kidney and bladder herbs is 八正散, and running liver and gallbladder 龙胆泻肝汤. Then micro, spleen and stomach, we use ginseng 1, ginger, fresh ginger 1, and baisu 0.5. Again, all the herbs put into tea bag and just make tea and drink it. Doesn't need to cook it. The acupuncture point still the same. Magical 8+1. Now, again, what we said in here is Magical 8+1 is a good strategy for IBS. And yes, it's good for heart condition and lung problem, stomach digestion problem. And in the original class of Master Dr. Tan, Richard Tan, he introduced that Magical 8 and Magical 8+1 treating the lung problem and digestion problem, stomach issues, mainly treating that. It also say that we can use it to treat diabetes and high blood pressure. Okay, diabetes and high blood pressure. Now we know all this, right? But when you look at the chart, the main that I put in here, okay, in this main, you see that I'm treating where am I treating? I'm treating from here to here. Let's go 8. What organ do we have from here to here? We have lung, we have heart. What do we have in here? It cover liver and gallbladder, pancreas, stomach, kidney, bladder, large intestine and small intestine. So it covers actually all organs. So now we know medical 8+1 can treat all the organs, not just the heart, not just the stomach problem, not just the lung issues. Okay, it can treat all the organs. Then we have another medical 12. Medical 12 treat all organs as well. So what are the difference between them? When do I choose medical 8? When do I choose medical 12? So this is the question. I think we talked about this last time. If you joined last time and you know how we use it, because last time case we used medical 12 and we talk about the difference between them. Okay. And the 23rd of July, sore tummy on navel and tenderness on kidney meridian daily still, but she could manage the pain as it will relieve itself. It's not too bad then, although she got it every day, but it actually subsides itself. Suggest her to do 312 acupressure point while pain and tummy. So what 312, the acupressure on 312, I suggested in the last webinar. You can go online and search it. Okay, the point is actually hergu, large intestine 4. Okay, and pericardium 6, neg 1, and as well as stomach 36. All those 3 points. So those 3 points, you can. I suggest patient when she had pain and she just go ahead and do the acupressure on those points. Okay. I ask patient do it every day actually from the very start. Let's see the post-diagnosis this time. Running, stomach, and Michael, kidney and UB. So that's changed again. The post changed again. So even though the patient is getting better, but the pain still there, right? And I changed the medication, Chinese herbs, because the patient post change. We use Wu Ling San and use Qing Wei San. Okay, very different. And one time we use Ba Zhen San, now we use Wu Ling San. Totally opposite Chinese herbs. Why is that? Would you ever do this? You probably won't do it because in patients getting better, you won't change the herbs, right? We don't normally do that. But with post-diagnosis, we do that. We do this because it's more suitable for the body right now because all the organs are getting better. When it's getting better, the energy is different. When the energy is different, you want to treat the energy, make it even better. You need to change the herbs because your body will tell you what is the situation right now. What is the best herbs I need right now? Which organ do you need to work on right now? So it's very different. Out of interest, I actually put in 六君子汤, a formula 六君子汤. We'll say, well, let's test it out whether add-on 六君子汤 will work better or not. Acupuncture is still the same, medical aid, but I'm gonna disappoint you because if you find here for looking for more useful acupuncture point, and in this case, we only use medical aid +1. And in reality, in the clinic, you find that medical aid +1 work for most of the tummy problem, most of the IBS. But doesn't mean that medical aid +1 100% treat all the IBS issues. No. Some patients, you put the medical aid +1, it doesn't work for them. It only reduce a little bit of pain. I have a patient recently before lockdown, New Zealand lockdown. I put medical aid +1, so. I put post-diagnose and insert the needle. It worked better than medical aid +1. But it didn't actually get rid of the pain completely. Okay, I do the cupping. Yeah, got better too. Then the patient come back and say, well, no, still not good. Not much different, right? Quite disappointed. Another time, I do it the same. Come back, still the same. So. Third time, I do it again. And she talk herbs. Come back. Oh, no come back. After third time, we lock down. Okay, we lock down in this case. But what happened is, after lockdown, she came back for a fourth treatment. They said, much better. I said, wow, without herbs, much better. That's great. What have you done? What have you done? I said, okay. While the lockdown, I changed my diet. I cut down all the meat. I'm on a vegetarian diet, just about all vegetarian, much less meat. And it got much better. She got panic attack. That's the main reason she came here, but as well as IBS. So I told her that by improving your IBS symptom, we will help your panic attack and anxiety. She can't drive. She still drives. She drives. She got anxiety. Then, you see, each time I give her acupuncture, she went home, she drives, she still get panic attack. No different. But after lockdown, she came back, she told me that her IBS symptom much reduced. Through what? Not because of my acupuncture, not because of my herbs. It's because she changed her diet. So as you can see, diet is very important. I know you have case, I treat a lot of them. We have case that without changing diet, we give them needle, give them herbs, they work very well. But guess what? Some patients you can treat it without diet. Most of the patients, you can't treat it without changing diet, without managing the stress and anxiety. So managing the stress, anxiety, and changing lifestyle of diet is very, very important. Very, very important. And guess what? The recent case of this patient, after lockdown, she came in, I needled it. Then she went home and then came in another time. Last time she said, this is the first time that she didn't get panic attack when she drive after acupuncture, last acupuncture. Totally 4 acupuncture, first, second, third, didn't work for her. She still get panic attack anxiety. Why? I asked myself, we need to find out why this patient respond to acupuncture, same strategy, respond to acupuncture very well afterwards on the 4th acupuncture. That is because the IBS symptoms is much reduced. As she changed her diet, her blood is more clean, much easier for acupuncture to work. You need to understand one thing is, we know when acupuncture treat the patient, Chinese herbs treat the patient, are moving the blood as well as moving the energy, right? You know what causing coronary artery disease? That people get stroke and heart disease, angina. That's because the artery blocked up, right? Why artery blocked down? Because they have plaque in it. Where is the plaque building from? Develop plaque in the artery. That is from cholesterol. So cholesterol built up in your artery. What happened? Your blood flow getting slow and slow and slow and slow. For example, this is the artery. So if I start in here, you see the plaques coming up. What is this? When the plaques crossing in here, all right, so what happened is less blood flow go through. If I close it all up, you get stroke. If that happened on your brain, you get angina, chest pain. You may die with chest because it's closed up the artery that no blood supply or much less blood supply to your heart itself. So heart didn't get any nutrition, any blood flow into the heart to supply itself, and it died. So we know one truth. The cholesterol built in your blood, the cholesterol in your blood slow down the blood. And I want to tell you one truth as well. People say, my cholesterol is fine. There's no problem with my cholesterol. I test it every year. And they are very big, large, and fat. And they never have cholesterol issues. That's because they have good enough HDL and bring the LDL to the liver, and the liver function is still good, and it cover it all up. And the cholesterol in the blood has been reduced, And if the cholesterol form to develop into plaque, you don't know, you can't see it, because the cholesterol that they check, as far as I know, the cholesterol that checking is in your blood, the LDL in your blood. It doesn't say about the LDL has formed to plaque. How much plaque do you have? It doesn't test that one because it's on the wall of the artery. It only tests the quantity of the cholesterol in your blood. So it's two different. Even though your LDL, your cholesterol is normal, it can still build plaque, stop your heart working and get you stroke. So that's why a lot of people, they are not on any medication, but suddenly they have stroke. And suddenly they have what? They have heart disease. They die. They go to hospital and they come out and they say, oh, now I have cholesterol problem. You see what I mean? So now we're going to talk about why am I talking those two a lot to you. I want to let you know the truth behind this. Changing your diet is important. And we know that saturated fat and trans fat causing cholesterol. Not just that. If you go to the China study, the book of China study is very valuable book. It's very informative book. It actually tells you that animal protein that increase your cholesterol. So when cholesterol increase, your blood flow actually slow down. When your blood flow slow down, then your acupuncture, you want acupuncture to work to make the blood flow to whatever you want to go, is slower. So in this case, patient actually change her diet to be better, not completely vegan or plant-based, much better, a lot of veggie, and much less meat. Okay, just meat just in one meal. It's very small portion, and she got a lot better in IBS symptoms. And after this, because she got a lot better, and we put needle in, and after she went home, she felt the first time she felt no panic attack. This is why I explained to her. This is because you have a better diet, and you got better in your organs, in your IBS symptom first. That is why the fourth acupuncture worked better for you. This is why I explained to her what I explained to her. Okay, that's it. Let's have a look in here. On the 31st of July, the Chinese herbs in here running the same as last time, right? Same as last time, so we don't expect. The acupuncture strategy, same, no change. The 6th of 8th, which is August, had coffee, then pain and tummy again. Abdominal pain has been much better, not much pain now. Slight nausea. Bowel once a day, still a lot of tenderness along stomach meridian and kidney meridian area. Okay, so yeah, tenderness spot getting worse a bit more, but in general she don't feel much abdominal pain. She didn't feel much of that. Okay, let's have a look on the post-diagnosed Yang Shen Yin Xu. Yeah, same herbs. We don't have to discuss this. It's the same as last time. Give it the same strategy, magical aid, same. And we have a re-exam. So re-exam is important. Why is important? Because we want to know how much better this patient, and we want to know what is the next plan. Do we keep going with acupuncture and herbs, or do we stop one of them? And how often we want to see her? Okay, so 50 to 60% better. Pain in the tummy daily, only 3 out of 10. Once a week, so the pain will happen once a week, 7 out of 10. And may due to stress or food, worse in the weekend. It's not during the week, it just works in the weekend. But not too bad. Nausea a couple times a week. It was daily, bloating daily, nausea daily. Bloating has not been bad. Manage people at work. Yeah, this is her work. So a lot of stress still. And upper back and neck and shoulder pain still. 5 to 7 of 10. Due to poor posture, that's still the same. Okay, now I didn't actually focus on treating her back. Why is that? Because I'm treating the root of the IBS, and this is the main complaint. I believe when the IBS symptom better, the organs better, and she will have much better posture, and the pain in the neck and back will get eventually better. Okay, we're treating the root. Waking up unrefreshed, tired still. Okay, fogginess a lot still. Acne comes and goes. A bit of eczema on hands sometimes. Not too bad now. Okay, a little bit, but not too bad right now. Headaches at the top, couple times reduced to once a week or once every 2 weeks. Okay, and the headache's much better. Wake during the night at least one time to urinate sometimes, not every night now. Okay, less frequent urination, so the kidney is better. And here you see it was frequency urination. Urgency to urinate sometimes, not all the time now. That's great. It was saying that difficulty to empty urine, right? That's gone now. That's pretty good. Low appetite still, but do eat more now. Eating better than before. and no fatigue after eating. It was fatigue after eating. Right now, it's good. Loose stools once a week in the weekend. Okay, type 4. So the loose stool actually in the weekend, not in the weekdays. So I asked her, what have you had? Having had in the weekend, you know, it's with no stress in the weekend. Why do you get loose bowel motion? Probably because of all the stress and release in the weekend. Maybe, I don't know. Gurgling noises in stomach after dinner, at night, or when she goes to bed. Okay, the noise happen at nighttime after dinner. So we really want to ask her, what do you eat at nighttime? And this patient, she tried her best. She's not dairy-free, gluten-free still, but she still eats some meat. Okay, it doesn't actually clean up all the meat. Okay, the animal protein. In my experience, when patients go for plant-based diet, it actually works a lot better, a lot faster in my treatment. And I see a lot and against when they on a clean diet, plant-based diet, and they respond to acupuncture very well and very, very fast. And the result actually stable. Now she said, black coffee is fine, but not with soy milk or milk. Okay, milk or soy milk are not good for her. Now you see, soya is plant, right? But doesn't suit everyone. Doesn't suit everyone. And even with plant-based diet, I suggest patients, you still need to check out what you can eat, what you can eat, because a lot of plant will disagree with your tummy. Okay, you may not digest all the plants. Okay, now I respect nutritionists. Okay, I respect because nutritionists actually suggest a low format diet for patient. It is good. Okay, but I find it a short sign of nutritionists. Nutritionists to focus on nutrition, right? It didn't actually check out what organs are out of balance. They don't talk about the function of the organs. As far as I know, I'm not a nutritionist. I'm sorry if I say something wrong. Please correct me. Now, what about the acupuncture short side? We are not a nutritionist, you know, so we don't know anything about the nutritionist. So as an acupuncturist, we just give them acupuncture and Chinese herbs. Then we never suggest them diet because we have no knowledge in here. Our school then teach us this knowledge, you see. So you need to, as a practitioner, you know lifestyle changing is very important. And we talk about the emotional cause disease, but what is our action when treat patient? We just treat with acupuncture and Chinese herbs. Now, ask yourself, how many people can afford to come to treatment to treat the emotional problem? Or how many people actually come to you to treat depression? And when you treat with depression, how suggest are you to just giving your patient acupuncture and Chinese herbs to help them reduce medication and eventually stop the medication? You see, if you just focus on your herbs, medicines, Chinese medicine, and acupuncture, I would say, yes, it will work, but there's a better way to combine with emotional daily practice, combined with the changing of lifestyle of the diet. You will find that all disease, no matter what disease come in, emotional problem and diet are always impact in all disease. It can be this patient are more with the diet related or more related to the stress or equally related to both. Okay, Now, when you focus on treating patient with the organs problem with acupuncture and Chinese herbs, they're important to address the emotional problem as well as getting your patient start to realize what is in their food. That is why we put a big note, a long note form for patient to fill in everything. We want to know what they eat. I'm not saying that a plant-based diet, you won't get sick. Don't get me wrong. I'm saying in plant-based diet, you are much healthier than the others. And when it comes to acupuncture and Chinese herbs, are much easier to deal with. Much easier to deal with, okay? When I first started acupuncture and Chinese, I don't force them. And I don't give much information about diet and emotional. But after a few years of my practice, I think that is crucial. And that is why I be able to get my patient from diabetes, high blood pressure, heart disease, and when they change the diet with my acupuncture and Chinese herbs, I started to reduce the medication, and eventually we stopped the medication. Again, we practice in New Zealand. I'm not saying that as a practitioner of acupuncturist and Chinese medicine herbalist. We stop the medication just by asking them, hey, you should stop it. Not that. We're doing it step by step. We give them herbs, Chinese medicines, acupuncture, and we ask the patient change the diet, give them information. We don't force them. It's up to them whether they want to change or not. They take the responsibility for themselves. And we ask them to do emotional daily practice to manage their stress, give the information, and we ask them, we don't force them to do our emotional daily practice. We ask them, do you have any solution yourself to do emotional daily practice? If you do, please practice it every day. Then when everything's so stable, like high blood pressure, stable, reduced and stable, sugar, blood sugar, reduced and stable, then tell them you need to track those numbers, and you need to, when it's time, refer them back to the doctor, the GP who prescribes those medications for them, and you need to tell them what side effect of those medication, and you need to point out what the condition they're having right now, they're suffering right now, as same as the medication side effect. You know, we're not scaring them. We're telling them this is the truth. And I find when patients started to reduce the medication, your progress get even better and more stable. And we refer them to the GP, and the GP tell them, give them the numbers, and the GP love the numbers, and tell the GP, ask the GP, how do I gradually and the right way to reduce my medication, and I want to stop it because I have been trying acupuncture and Chinese herbs and it's working well right now. Look at that, the number is getting better, and the GP need to give them the proper way to reduce. This is the patient right. Okay. Again, and here, some patient, I ask them, do you want to reduce your medication? No, that's fine. What do you want me to help you? Whatever we help them, that's it. We help them according to what they need, not what we need. Okay, this is important. So without changing diet or taking care of the emotional by just doing acupuncture and Chinese herbs, yes, you can do that. Reduce medication, stop the medication, but risky and slow, and I don't have the confidence with that. And I will encourage you to get more of this information. The China Study is a good book, and a lot of emotional daily practice book. Your Limit is another one. There's a lot of them you should find out as an acupuncturist because you can help patient even further. Okay. NLP, if anyone practice NLP, it's a good way too. Okay, that's it in here. re-examination. So I give her another plan, one acupuncture weekly with Chinese herbs, and the herbs gonna do prescribes every week. When she take the herbs, she come and get the herbs, and for 7 days for the next next 4 weeks. 16th of the August 2019. Has some cake this afternoon and pain present on belly button. That is when she came and she told me. So I took the pulse, totally opposite. Hasn't got any pulse of running, it's just micro. And the micro pulse on where? On the spleen and kidney, which is kidney and spleen are strong. Kidney compared with bladder, kidney strong, now bladder's weak. Remember in the very first, the bladder is in here, the kidney in here. Now the kidney in here, the bladder in here, totally opposite. You know? So what about the symptom? The symptom get better, but it's still IBS. It's still pain in the tummy sometimes. And you check it, it may still in the kidney meridian, run meridian, and stomach meridian. The symptoms, you can't see any change. But in the constitutions, the pulse, the organs are working differently right now. And it works the opposite. So what do we do right now? We change the herbs. We use Wuling San. We use Ba Zhen San in the first. Now we use Wuling San. In the spleen and stomach, we used to use we call Qing Wei San. Now we use ginseng, ginger, and baisu. And 补中益气汤. Now we use 补中益气汤 because 补中益气汤 is very good for stomach and spleen. When spleen is strong, stomach is weak. Okay, set it on, put it in here, and so we reduce yin and tonify yang. Totally opposite. Acupuncture strategy, no change. We still use Magical 8+1. Now, has been good for a week. No tummy pain, basically. Only tummy pain a bit yesterday. And she started walking for 15 minutes daily. Okay, that's good. What does it tell us? This strategy, the herb strategy over here, is right for her. This was to get better. Okay. Okay, in the back here, the patient, okay, funny. All right. I think there's another email that I didn't put it in here. We put on this patient on a record list. The patient got much better. In the September, I actually presented another plan for her on the September, and the patient said that she had a financial issues, which was her vet went to her pet went to vet and spent a lot of money, and now she's much better. So she need to take care of her vet pet. So she hasn't got a budget for treatment for herself. Okay, then she says she want to call in one day, so we put a recall on her. So we keep calling her weekly until the 18th of October. And my receptionist Alicia and call, and the patient we call C said that she got my email, was just waiting for the weekend to reply. Said that she is actually been really good lately and doesn't feel in desperate need for treatment. Had a really bad patch that was helped a lot by the treatment she received and is doing good now. Going on holiday in the next couple of weeks, so she'll be busy, and Christmas coming up, but could be interested in maintenance care once a month. Email in the next year to check in, but otherwise leave it with her. Okay, so we put a recall, and we haven't got back from her yet. So we went to lockdown time, and we're still calling and emailing this patient to find out what's going on, whether she is all good now. And I doubt it, because IBS is not that easy yet. Okay, I doubt it is all good, but if it's good, I was very, very happy for that. Because so treating, I'm sorry to disappoint you, because this case is not happy ending, you know, all good, you know. No, it's not that. This is a real case. This is how we treat it. So it's not ending yet, but I'm showing you that with the acupuncture and Chinese herbs, and we took pulse and we diagnosed according to it, and I show you that Magical 8+1, you can see that the patient, and in the last 3 months, how she felt better, from 2 acupuncture down to 1 acupuncture weekly, from daily stomach pain down to just about no pain, and from 3 times bowel motion daily, loose bowel motion or watery bowel motions. Then, or sometimes if she get constipation, she stopped bowel motion for 3 days, and now she go the last re-exam, bowel motion daily, every day, regularly. And yes, she still got some pain, but manageable. Okay, and yes, she still got some loose bowel motion, but only in the weekend. Otherwise, pretty good. And there's no nausea for her, no dizziness for her, and no vomiting for her. So that are all improved, and her urine improved as well. So it's not a happy ending, not cure as such, not fixed as such. Okay, so but it's the way that acupuncture can help them, and Chinese herbs can help them. Okay, I hope that this is just sharing of case study, and I want to hear from you for all the conditions. I know you all experience acupuncturists and Chinese herbalists, and I want you to share. I want you to be open-minded, to be generous, to share your knowledge in here. If you were the practitioner in this case, or your experience with IBS, what do you normally use? What strategy in Chinese medicine and acupuncture? And do you suggest diet, or do you suggest emotional daily practice? How you manage the emotional? How do you talk to patients? So I just want to know. I want you to share with everyone here. Now it's your turn to share now. Thank you. With her eczema flare upwards with the meat also. Which one? Not this one, no. Pretty stable, the eczema pretty stable. And let me know your question if you have any question. The question is, what is the best strategy for IBS? Do you have any? I will use a lot and teach the client about emotional freedom technique combined with NLP. That's great, Ellen. So Ellen knows NLP. NLP is a great strategy. I heard a lot about it, but I have no, I never learned it. So I have no idea about NLP, to be honest. But I use the, Ellen talked about this tapping technique. I use this combined with emotional daily practice, the Ho'oponopono method. And my main thing is Ho'oponopono method, because I use it for myself, and a lot of my patients use it. Very effective. What is NLP? Google it. I heard a lot of NLP, but I didn't get a chance to learn it yet. And I have patients who are working in NLP, and they are tutor of NLP, and they join a lot of classes NLP as well. And that's available in Auckland NLP class in Hamilton. But again, I didn't get into NLP. But NLP is very good stuff. NLP. But any of you? So any of you? So my way, when it comes to treat anything, including IBS, is always all 脏腑 organ functional diagnose. This is the base. This is the root. And use a combination treatment. So I won't just use acupuncture. I won't just use Chinese herbs. I will suggest Chinese herbs, acupuncture, emotional daily practice. I call emotional daily practice, which Ellen using NLP, which is very good. Now we want to hear a lot of more about NLP and diet change. And I use heat pack. I encourage patients to use heat pack at home on the tummy. And I ask them to do acupressure point DIY. I film all the video for them and ask them to follow the video if they have any confusion that they're not understanding, and they can come to me and I can teach them one by one, something like that. And in the re-examination, I ask them, have you done all this? You know, this is part of our plan. Okay, so you find that some patients, they work very well. They don't have to do anything. You know, just your acupuncture and Chinese herbs. But the others, they haven't doing well at all. And then what happened? They just relying on your acupuncture and Chinese herbs. And they are not improving well. Or they improve and they stuck in some way. They can't go any further. Then I say, well, have you been doing your emotional daily practice? If you haven't, or you have been doing it, but just on and off, not daily. Do it daily. Have you changed your diet yet? Will you consider change your diet to go for plant-based, especially when you have wow treatment? This is the best time for you to change. And I introduce a diet for them and ask them to buy the book and read the book, get information from that. And I ask them, have you been doing the do-it-yourself acupressure point at home yet? If you haven't started, this is the re-examination for. Yes, you are correct. Diet control and acupuncture, but if it is emotional related, the patient needs to adjust emotion by exercise and consultation if needed. That's great. I was thinking EFT. Yeah, EFT is good too. Not sure if it's similar with tapping. Yeah, EFT is the tapping technique. You know, I think everyone knows a lot about EFT. We have a course of EFT. David, can you give a quick rundown on your method of taking the pulse for this client and any instinct into cupping on the abdomen, as I would like to start doing this but have avoided the tummy. Thank you. All right, David, good question. Now I have the same question from last webinar on the in Chinese last night. Okay, the cupping, I use a large cup on the belly button. It works very well, and I don't know that a few of them been to my workshop in Auckland, right? I told you this. Okay, I don't know whether you started use yet and use this method yet. And a few of the acupuncturists, like Kenny yesterday said it works very well. Kenny, you may want to share what client do you use on, what case do you use it on, and what the experience with cupping on the belly button. And I have heard last night from one of the students who said she used it on acne. It worked very well. And use it for depression, and it worked very well. What else? That's in my memory. The rest of it, I don't know. And I use it mainly for infertility patient and tummy pain. And you can draw out the corners. I actually had a chance. I promised last night that I would do a video how to present, how to talk to patients about the cupping things and how to do the cupping on patient. I actually did a video today on my patient. I filmed it down with my patient's permission, and I can share with you. But of course, in this technique, I'm not going to share on Facebook or YouTube. The reason of that is because I learned it from Kirsten Wall from Australia, Melbourne. Okay, I don't have the permission to share his knowledge in public, but I'll put it in my platform. This is the platform, free BMA webinar on this link. So if you want to watch this video, please sign in, and you can get some webinar for free. And the previous webinar that we've been done once a month are all on the website, and you can learn balance method acupuncture, basic local balance, part of the local balance, acupuncture 1, 2, 3 for free. Okay, so I'll put this video, today's recording, on the website as well, and I'll put the navel cupping, teach you how to do that, on the website as well. Okay, you have to sign in. So this is how I do. You need a coin. I put on the tissue paper, and the four ankle, take it out like this. So just twitch it like this. You see this? Okay, then put it on the belly button. Then you need to explain to your patient what it is. Why do you have to do this? Okay. So if you want to know how I explain to the patient, go and sign up there. It's free, and you can watch that. I've got the video. I haven't uploaded yet. Then what happened in here, you have to tell patient, because you light the fire on your patient tummy, they will scare, they worry that you burn them, and you need to explain to them. You're going to show them what you're going to do. They need to expect what's happening. The expectation is very important. And then you light it and you put it off on a cup on top. And I figured out it at first when I learned it. We did it for 5 to 10 minutes. But in the end, I figured out for tummy pain, just 1 or 2 minutes. That's it. You don't have to do it long. Just 1 or 2 minutes. And the patient tummy will reduce a lot. And you will suck out all the corners. Normally what happens is I put a heat pack on top first while the acupuncture. When I come back, remove the needle and remove the heat pack from the tummy, and the tummy will be all hot, right? Because of the heat pack. Then I put a cup on top, do the cupping, and in 1 or 2 minutes, release the cupping, and the cup over there, all the other skin are still warm and hot, but in here it's cold. And you use the patient hand, let them touch it. This is how cold your tummy. Just about everyone can pull out. I recently had kids come in. I do that. It was cold. Before lockdown, it was cold. And we keep doing it. When she came in the last few weeks, 2 weeks, right? She came in and it's getting warmer. And all the skin are warm on the cup, and only a belly button on the small hole of the belly button navel is still cold. That's it. And he felt it too. He said, wow, it's getting warmer now. It's just a little bit cold right now. That's it. Do you have any concern about pulling out the patient zhou qi from the belly button point, as this would be a concern I would have? No, that's why you put coin. That's why you put coin in here. No concern for that. The coin actually prevent that to happen. Kenny say, oh yes, Chun Li, please sign up to this platform for the replay of the earlier part of this webinar that you missed out due to the sound problem. Yes, you can sign out of this because we're going to record this, and this is recording right now, and then we're going to put it on a platform and you can watch it for free. And when you watch a recording, you're not entitled to the CPD, okay? Thank you. Right? So what is the best diet for IBS? You have to figure it out yourself. If a patient didn't figure it out, I don't know. We have someone work as nutritionist. I want to know that how well when you do suggest low formats and a day-old patient get respond and very well and they continue respond. I'm sure they are, and I want to know whether there's any patient that on low format diet they got worse, and what is your key to trigger to get them better again. Because I have few patients with low format, but some of them they work very well, and I do some research online, and people say that when they do low format, they got better for a few months, and when they keep going, just like this case, when they keep going, it didn't actually work for them. It got worse and worse and worse, and they didn't know what to do. So I don't know about your experience. Low format diet is the best for IBS. That's what all the practitioners know about it. Nutritionists, acupuncturists, naturopath, they all suggest low format diet for IBS. You know, I'm different. I don't care about low format. You know, I only care about plant-based. If you go plant-based, you get better. But even though you go plant-based, you have to figure out what is in your diet actually upset your tummy. Listen to yourself, listen to your gut, and your gut will tell you what is good for you, what's not good for you. Okay? Right. Can you share, please? Are you familiar with low format diet? And what is the outcome of low format diet? Again, my answer is plant-based and vegan diet. And I've given you the website. Okay, this is the website. You want to join the freebie webinar platform, and the following link is follow me. It's on the Acupuncturist Facebook group, and you can follow me on live Facebook page, and you can follow me on YouTube channel and Instagram channel, Szenan-Balance. So all this channel that I'm doing live video, they got a lot of information. I'll say case study, and I'll share with you some like Bai Hui 12 needle, Bai Hui 8 to treat the organs and what do they do. And I share regularly, just about every day, and live video definitely every day, every morning, 7 o'clock, 7:30, something like that, for half an hour. Thanks for a wonderful lecture. Good evening. So next month we will have another workshop of this, and I'm planning. I may go to talk about medical 8, medical 12. You know, just give free lecture of how to use medical 8 or 8+1 and what will you use it for, why do you use it for, and how to use it in the clinic, and medical 12, you know, and then teach you how to do what? Using Bai Hui 12 needle and Bai Hui 8 needles, which is in the body you do medical 8, right? On the head you can do 8 needle on Bai Hui 220. It just depends. You don't have to put needle on the hand, and it will work. Some cases work the same, some cases work better. For some cases you want to combine the Bai Hui 8 220 with 8 needles with the medical 8. And I share some video about medical 12, treat the entire body pain, which we normally use medical point and hand and legs treat the entire pain. But you can just use on top of the head and treat the entirely pain of the bodies. Okay, so I'll teach those. It's free. You can join in or put it in once a month and slowly give it to everyone so you can practice it. And I actually share with you in my daily practice, daily live video already, but I will do a proper one for 2 hours so you can get CPD and you can hear from this. Okay. Thanks, Dr. Phua, for such a wonderful case discussion. Thank you. Right, for the diet is important. I agree. Thank you. Suki, thanks for the lecture tonight. Have a nice evening. Thank you. Thank you, Szenan, for your time. I appreciate that. Thanks very much, Szenan. A great webinar. Thank you. Thank you. Yeah, that's it. It's 10:01 now. We can finish here. If you have question, you can stay in here. If you have no question, it's 10 o'clock now. I don't want to hold you in here. If you leave right now, you get a certificate. No worry about it. Okay, so Kenny, thank you, Kenny, again. Kenny will download all the list and create a webinar, a certificate for you. And again, you have to join the Facebook group to be able to get the certificate. That's the only way you go to. Okay, we are not going to send you email to you and to inform you, hey, here's your certificate. Here's your certificate, or if you miss out your certificate, you come to us. No, go to Facebook group and ask your question in the Facebook group. Okay, thank you very much. Well done, so helpful. Thank you so much for your share. Many thanks for Michelle. Michelle, thank you. Have a good night. Chun-Li, thanks. Kenny, thank you, thanks. Right, that's it. Do you guys have any question? If there's no question, we will lock everyone out of this platform. Okay. Okay, I'll wait for 2 minutes for your question about this case, or about the anything about this case, or anything about IBS, anything about medical 8+1. I encourage use medical 8+1. Okay, what happened is, if you have patients have stomach problem, let's say they have digestion problem, and they come with pain. Doesn't matter whether it's lower back pain or whatever pain. You can treat those and you add on medical 8. If they have digestion problem, they have stomach pain, you add it on, combine with whatever you use, plus medical 8. Then you will find that this patient result will last even better, and they respond even better. You find that maybe just on one treatment, you treat whatever, the shoulder pain or lower back pain. You treat it, and the pain is not stable, right? It keep coming back very quickly. Then that's because you're not treating the organs, especially if they have tummy problem, bloating, tummy pain, diarrhea, then you put medical aid to treat those things. And other treatment, you treat this shoulder pain or lower back pain plus medical aid. And the next time you ask your patient, how did you feel last treatment? They will feel much better, and they will feel that the result actually lasts longer, more stable. You know, I figured out this myself in my clinic, and I actually, in my webinar, in my Chinese WeChat group, and I share with them, and I share with my students and say, this is something that you need to use in the webinar, and the local balance webinar, and I give them bonus strategy of using, they're using local balance. I introduced it that this is global balance. You know, it's not included in this class. You know, it's the next advanced class. But don't worry, just take it, and this is a bonus. And I ask them to use it on top of it and do the test themselves, doing local balance first, a couple of times, and add on medical aid. And you experience which one work better, just local balance work better or local balance plus medical aid. If those patients have a severe or they have imbalance on the organs, they always respond better with medical aid plus whatever you do. Okay, that's it. Good. Now you let me know what do I need certificate to prove I joined the seminar to ACNZ? Yes, and you do need that. Go to Facebook group. That's why we say you need a certificate, you go to Facebook group. Okay, remember you only get 2 CPD if you're joining tonight and yet last night, okay? You only get 2 CPD, you don't get 4 CPD, okay? Even though you get the certificate on both English and Chinese, but unfortunately you only allowed to send, don't make too much work problem for your association. Please just send one to your association. Doesn't matter whether it's ACNZ or NZASA. Thank you. Yes, please. And if you don't have Facebook account, you do have to make one and access to it to get your certificate. Thank you very much. If people, how about people has not FB account? We can't help you with that. I'm sorry. This is the conditions that we put in there. We're not sending the certificate one by one to you guys. You know, there will be too much job for us. And Kenny is so wonderful that he actually took this job. I used to do it all myself. And Kenny, you know how much work you've been doing for us. This is what I did all myself, one person. And then I have to get my clinic person and my assistant to help me, and I pay them to do that. But I thank you very much for Daisy and Kenny again, doing all this for us. And yes, Susie, I'm so sorry that I have to tell you that you need to get a Facebook account and join into the Facebook group. And we're not going to send individual certificate to everyone. I'm so sorry about that. There's too much work for us. Can you say, team, please be patient with the replay and certificate. We will try this to sort this out as soon as possible. Thanks again. Chinese, wonderful. Yin yang, so thank you. That's it. If you have a question, please quickly ask. Otherwise, once I stop the platform, and it'll automatically log out everyone. So we won't discuss in this platform anymore. If you have any question, please immediately just ask us. Okay, I'm gonna stop the recording first. Stop.